Researchers say that First Nations patients are more likely than non-Indigenous patients to leave Alberta hospital emergency departments before receiving care, and that racism is part of the reason why. A study published this week in the Canadian Medical Association Journal finds provincial data from 2012 to 2017 showed 6.8% of First Nations patients left ERs before being seen or against medical advice, compared to 3.7% of non-First Nations patients. Study author Patrick McLean of University of Alberta says that after controlling for other variables, First Nations status was the only apparent explanation for the difference. Joining us now to discuss racism in medical care is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Thanks for joining us.
Great to be here, Julie.
When you first saw the findings, what was your initial response?
Well, it was very saddening to see. And really, if we see something like this, it should make us all quite a bit sad. I can say that the findings in this study really highlight a significant issue that we're having with healthcare that requires attention. Really looking at the fact that First Nations patients are more likely to leave emergency departments before even receiving care is really a serious concern. And I think we're seeing some systemic issues here within healthcare that need to be addressed. I don't think it's necessarily just in provision of healthcare, but also in the environment which is provided. And really, these experiences of First Nation patients suggest that they really don't feel comfortable or even respected in these settings.
So let's talk about what circumstances would cause someone to leave an ER before being seen.
Now, patients can leave an ER before being seen for quite a difference of reasons. This could include, perceived wait times, perceived quality of care, communication barriers, personal or cultural factors. In the context of this study specifically, First Nation patients had reported experiences of racism, stereotyping, communication issues, transportation barriers, and long waits, and oftentimes being made to wait longer than others as reasons for leaving. Now, I don't think this is something that's specifically just in the emergency department. I think these are systemic issues within the system that are contributing to this problem.
In terms of the research, can you walk us through how it was concluded that race was the only explanation for the difference?
Yes, and I think the authors did a very good job in looking for that specifically and removing a lot of the other factors. What they did was they controlled for other variables such as diagnosis or visit acuity or geography or patient demographics other than First Nation status. And then when you controlled for all these variables, the researchers found that First Nation status still played a major predictor for patients leaving without being seen or against medical advice. So that suggests that obviously there are some factors associated with being a First Nations patient that are influencing this outcome. And this factors could include experiences of racism and discrimination, along with a lot of other systemic barriers.
Now, how do these figures compare to overall health figures for First Nations? Are we seeing corresponding negative outcomes generally increase for First Nations people as a whole?
I think that's a great question, Julie. In terms of overall health figures, what we're seeing is there are still health disparities between First Nations and non-First Nations populations that really exist beyond the emergency department. An example for this is, significantly higher proportions of First Nation people, Métis and Inuit across Canada report being without a regular healthcare provider compared with non-Indigenous counterparts. Now, how much higher are we talking about? Well, as an example, 1 in 5 First Nations people do not have a family doctor or care provider. And in the Inuit population, that number is close to 1 in 2. So significant health disparities.
Wow. And most importantly, how should the medical community respond and react to this? What changes need to be made?
I think the first step here is education. So many of us may not know this at all. So educating not just the medical community, but the overall community, like you're doing, on creating a more inclusive and culturally sensitive healthcare environment or other environment. I think in the medical community, we should all just take a second and reflect on the very unique healthcare needs of First Nations patients and our respective roles, perhaps work to implement policies to reduce wait times improve quality of care and working with First Nations communities in a very meaningful way. And additionally, I think it's very important to recognize the broader social determinants of health that really contribute to these disparities, such as even clean drinking water and housing.
As always, thank you so much for your time.
Thanks so much for having me.